Hi, I'm Steve Pepper. I've been 55 years in the food industry. I've been a food safety trainer for 30 years and I'm an ex-NHS control of infection rep. Coronavirus, Covid-19. This is now a worldwide pandemic. So what are the effects of the virus? The World Health Organization says about 80% of people with Covid-19 recover without needing any specialist treatment. Only about 1 person in 6 becomes seriously ill and develops difficulty in breathing. If you need to be hospitalized and you develop pneumonia, you will need to be ventilated and maintain high oxygen levels until your lungs are able to function in a normal way again, and if you recover. Even if you recover, the lining of the lungs can be permanently damaged. Covid-19 causes a dangerous and potentially fatal condition known as acute respiratory distress syndrome, or ARDS. Eventually the wall of the alveolus gets thicker than it should be. The thicker this wall gets, the harder it is to transfer oxygen and the more you feel short of breath. The more and more you start moving towards severe illness and possibly death. So how do you get this infection? Because the disease is transmitted by the airways, unlike norovirus, which can be foodborne as well as airborne, any contact with someone who's infectious will be a problem. Hence, that's why you've got the 2-metre social distance limit in the UK. You could get Covid-19 from an infected person's sputum or transferred by touching your face with a contaminated surface, i.e. door, fridge handles, tap tops, sinks, light switches, food containers, or unwashed hands, etc. Below you can see there are some exceptions. So restaurants that were previously told to close on the Friday can now do food deliveries and takeaways can remain operational. This won't necessarily last forever, so keep your eye on the news. So a lot of caterers who've had to close have decided that they want to do takeaways. There are a few problems with traditional takeaways and caterers who want to change their method and provide a takeaway service during this pandemic. 1. Social distancing of customers. 2. Social distance of staff. 3. Effective hand washing. 4. Exclusion of potential carriers, some of whom may be asymptomatic or not be showing any symptoms of the disease. 5. The packaging of the deliveries themselves. The outside of the package can become contaminated, so there's some information further on about how you deal with this. And then lastly, the temperature of food during this process, whether that be hot food or whether it be cold. On a typical one-man band setup, this is relatively easy to control, i.e. one production staff and another person hired in to do the actual delivery. With a bit of thought, most of the personal hygiene and social distancing problems can easily be overcome. So you've got whoever's doing the food production, whoever's separately doing the food distribution, and how people are washing their hands. Things are changing on a daily basis. What is legal now may not be in a few days' time. Keep your eyes on the news and check with the following websites. Public Health England, Camden websites. There's a good video on there by a virologist. And then you've got the NHS UK. All of those are available. Just do a Google search if you haven't got time to write down these websites here. So, converting from a cafe, restaurant, hotel to a takeaway. Registration of food business. This is a legal requirement and you're expected to register 28 days before trading starts and keep the local authority informed of changes to the business use. So if you're just changing to a takeaway, what I would do is inform them by email. Most of the local authorities under the current circumstances will probably accept that. They might need to come back and check on you by doing a WhatsApp type video check on you. They may not, but check with the authority first before you change over to takeaway. Types of food: hot and ready to eat cold. If you then want to home deliver hot and cold food, there are a few things that you need to consider. You need to keep food hot or cold before delivery, and using an insulated food grade box, hot box or an ice box is one way of doing this. Social distancing of at least 2 meters away from your customers. Although food is not usually considered a vector, the virus may be able to survive a high temperature, so boiling soups and stews will be fine, but ordinary cold temperatures may not be. You need to know that it is thought that hot food is not an environment that the virus will survive. You can check this out on the relevant government sites for the latest advice. The preparation and or delivery food could though be a factor. Remember, the virus needs to be inhaled, i.e. droplets from people coughing or touching your face with contaminated hands. Also, hand washing is much more effective than alcohol-based hand gels. Isolation of you or your staff. If you show signs of becoming ill, you should make arrangements to self-isolate, including your family, and if possible, have to implement contingency plans or closure of the business. See the official government guidelines for the current advice. Social distance during delivery. There should be no physical contact between staff, delivery staff and customers using the information provided here, or if the government advice changes. Hand washing is also key, plus hand and food contact surfaces. Social distancing, the current advice is at least 2 meters apart. It goes against food hygiene rules, but leave the food at least 2 meters outside the customer's door. Phone first and wait and double check that they've actually taken the food in. Cash handling is also a problem, so unless they can leave the exact amount that you need and you have plastic bags to collect the cash, i.e. turn them inside out to prevent contaminating your hands. Other than that, take digital payments through things like PayPal, card payments or BACS. These are the only other realistic alternatives. It should be noted in the UK that £5 and £10 notes are now all plastic, and these can easily be washed, as can coins. But £20 and £50 notes, paper notes, you'll have to quarantine until it's safe to handle. Plastic containers. I would suggest using clean, takeaway type plastic containers for this. Have a written statement to say how the customer can safely sanitize the outside of the container, including hand washing before handling it and eating the food. The outside of the container could become contaminated. With cardboard and brown paper containers, James Lloyd Smith, who's a professor in the US, has stated that this virus is quite transmissible through relatively casual contact, making this pathogen very hard to contain. So with things like takeaway boxes, ensure that they are clean and only handled by people who have washed their hands. Hand washing. Effective hand washing is key to prevent spreading the infection. If you want a free fact sheet, just go to my website or Google Steve Pepper and you should be able to get to it. There's a downloadable fact sheet on there. There's also a booklet on food safety as well. This is all okay, but what if you're a sandwich bar or supplying other ready-to-eat products that you handle? Well, in this case, as long as you can prove that everything is decontaminated on arrival, then you should be fine. This can be done by a hypochlorite wash, for example, on things like lettuce. If you can safely quarantine such items or have a strict hand wash, nitrile gloves and a hand gel policy, then you should be okay. As long as you follow this and the government's updated advice and you or your staff don't have any symptoms, then in theory you should be okay to operate. Remember to wash your hands thoroughly. See my website again. There's also another set of downloads on other things there as well, and I'll be putting some more up over the next few days. Thank you for watching.